come in?
Hi, Mr. Gonzalez, Performing Hand Hygiene. How are you doing today?
Good.
My name's Yvette. I'm going to be your nurse today. I'm here to do an assessment of your abdomen. Is that okay?
Yes.
Before we start, I'm going to go ahead and ask you a few questions. Do you have any problems, or have you had any problems with your stomach or your bowels?
No.
Have you previously had any abdominal surgeries?
No.
Do you have or have you had history of heartburn?
No.
And have you ever been prescribed any medications for heartburn?
No.
Okay, so we're gonna go ahead and get started. Now I'm gonna look down here for the contour. I see his abdomen is rounded. And then I'm gonna go ahead and look at the end from the end of the bed to see symmetry. An abdomen is symmetrical. I'm going to come back to the side here and inspect. I'm going to go ahead and look for abdominal movements, and I see normal respiratory movements, and then about 2 inches above the umbilicus I can see the aortic pulsations. And then at this time you would also look for peristaltic waves, which I do not see because it's a good thing. If you do see them, they are abnormal. As well as I see the umbilicus and it is inverted. Now, I'm also looking for lesions or scars or any moles. And if my patient were a female, I would see if they had an umbilical piercing, and I would see for scarring or drainage and see if it has been healed. Now I'm going to go ahead and listen. Is that okay, Mr. Gonzalez?
Yes.
I'm going to go ahead and auscultate all 4 quadrants with the diaphragm of my stethoscope. And as soon as I hear a bowel movement, or bowel sound I can go ahead and move on to the next quadrant. It's usually within 5 seconds of auscultating the quadrant. I was able to hear bowel sounds in all 4 quadrants, and they were normal. Now I'm going to go ahead and listen to vascular sounds, the aorta, the renal arteries, and the iliac arteries. The reason I'm listening to these is for any abnormal sounds like bruit. The aorta, all of these I'm going to listen to with the bell of my stethoscope. The aorta you will find about 2 inches above the umbilicus down the midline. Now the renal arteries around the same height above the umbilicus, but only to the right and left. Now for the iliac arteries, you go down about 1 inch from the umbilicus and 1 inch to the side on each side. So go down 1 inch and then 1 inch to the side. And then the other side, another inch to the left. I hear no signs or sounds of bruit, which is good. You could possibly hear a heart rate, but should not be hearing any sound. Now I also see that the patient's umbilicus is inverted, which I had missed earlier. But now that I'm done listening to bowel sounds as well as vascular sounds, I'm going to go ahead and start palpating. Before I begin, I'm going to go ahead and ask Mr. Gonzalez. Mr. Gonzalez, do you have any pain or tenderness in your abdomen?
No.
Okay, so I'm going to do light palpation first, which is only pushing down about 1 centimeter lightly and making sure I palpate the whole abdomen. So I'm going to start out all the way over here. Do you feel any pain or anything, Mr. Gonzalez?
No.
Discomfort? And I'm going to make sure I'm pushing in a rotary direction or movement all around the whole abdomen. I'm feeling for lumps or any masses Now I'm going to go ahead and start my deep palpation, which is about pushing deeper in about 5 to 8 centimeters. Again, Mr. Gonzalez, if you feel any pain or discomfort while I'm palpating or pushing down, please let me know. While palpation, make sure to tell your patient to be relaxed. Upon palpation, abdomen was soft, non-tender, and I felt no masses or lumps. And that is the end of my assessment.